Hi all, welcome to Oet Speaking. Today we can discuss an Oet role play. Here the setting is an emergency department. You are speaking to a 30-year-old man who has come to the ER due to a bite from a dog on his leg. Task: inquire about the bite, reassure him and explain about what you are going to do now. Dressing, sutures not needed. Explain about the need for TT injection. Inform that the doctor will come and examine. Antibiotic may need to prevent infection. X-ray needed if the doctor suspects any tendon damage or fracture. Here the setting is an emergency department, but the dog bite is not an emergency situation. So we can start our conversation by saying, "Good morning. My name is Sarah. I am one of the registered nurses working in this emergency department. I can see that you have an injury on your leg. Could you please tell me what happened?" In this way, you can start our introduction. Then the patient may tell you like, "Today morning I was walking to my friend's home, then suddenly a dog rushed up and I got a bite on my leg." At that time, as per our first task, we need to reassure the patient. We can say like this, "Oh, I'm so sorry to hear that you got a dog bite. You don't need to worry. We will take care of you." Then we can ask his name. We can ask questions like, "Before proceeding further, could you please tell me about your name and age, please?" Assume here the name is Mr. John. The next thing, you can assess his wound. So you can ask permission for that. "Mr. John, can I assess your wound?" After 1 second, you can continue. "From my assessment, I understand that the wound looks like a shallow cut in the skin and it's not a deep one. I will explain what I am going to do now. I will clean the wound with a lot of saline. After I clean it, I will apply antiseptic ointment and put a dressing on it. Is that okay?" Then, probably as per the interlocutor's card, he may ask you questions like, "Sister, why no stitches? Or do I need stitches?" At that time, we can say like this, "Mr. John, it's better not to suture the wound because it's a superficial wound. So it's good to allow the wound heal by themselves. Are you following me?" After that, we can ask about tetanus injection. We can ask like this, "Could you please tell me when you had your last tetanus shot?" Probably the patient may reply like, "Sister, it's more than 10 years, or sometimes he may reply like, he don't remember that because it's long back." In that situation, we need to insist him to have tetanus shot now. We can say like this, we need to insist him to have a tetanus shot now. We can say like this, "Mr. John, it's always better to have a tetanus injection now in order to prevent the infections like tetanus." Probably he won't agree with you and he may reply like, "I don't want injection because it's a clean wound only." In that situation, we need to reassure him by saying, "I can understand that you don't want an injection if it's not necessary. But you know, Mr. John, it's really important to have tetanus shot after dog bites in order to prevent yourself from tetanus infection so that you can protect yourself. Have you heard about tetanus infection?" Then we can say, "You know, Mr. John, it's a serious condition, so we need to get protected from this condition. Are you following me?" Probably he may agree with you. Sometimes he may argue with injection. At that time, we can say, "Mr. John, your health is our priority. For the sake of your health, we are insisting you to take this injection. I understand that you are really worried about the injection. The good thing is you won't need another tetanus shot for 10 years after you have this one." At that time, he may agree with you. Then, as per our last task, we can tell him like, "Okay, Mr. John, the doctor will come and examine you within minutes. Now, I'm going to clean your wounds with saline. Is that okay?" Probably he may ask you questions like, "Sister, do I need to take antibiotic?" Or we can ask like, "Do you have any other concerns?" Then he will tell his concerns about antibiotic. At that time, we can say like this, "After examination, the doctor may prescribe antibiotic in order to prevent infection. Mr. John, bacterial infections are common complication of dog bites. If it left untreated, it can cause severe infection. So if your doctor prescribes antibiotic, you need to take them for 1 week. Are you following me? Then probably the patient may agree with you. If the doctor suspects any broken bone or tendon damage in your leg, then you may need to have an X-ray. Is that clear? After that, we can wind up our conversation by saying, do you have any other concerns? If he has no other concerns, we can say, I hope I have cleared all your concerns. Thank you, Mr. John. I'll be back with all arrangements for dressing. Thank you, Mr. John. I wish you a speedy recovery. Sometimes the patient may ask about the dressing at home. Then we can say like this, I will give the dressing material to take home so that you can change the dressing at home. If he doesn't like the dressing at home, or if he doesn't like to change dressing by himself, then we can say like this, you won't have to change dressing yourself. You can come back to hospital tomorrow and have the wound checked and redressed. Then if he asks about the instructions at home, we can give some instructions like, try not to get the dressing wet. When you have a shower, one way to keep the dressing dry is to cover it with a plastic bag. Is that clear? These all instructions you can give to the patient. Okay, thank you all.